Why is a lymph node biopsy vital for lymphoma diagnosis? Imagine trying to solve a mystery without enough clues. That's what diagnosing lymphoma can feel like without a proper tissue sample. A lymph node biopsy is essential because it provides the most direct evidence of what's happening inside the lymph nodes. When doctors suspect lymphoma, they need to see the actual cells to confirm the diagnosis. Blood tests and imaging scans can suggest something is wrong, but they cannot definitively identify lymphoma or tell us what type it is. Lymphoma develops from abnormal lymphocytes, which are a type of white blood cell. These cells normally help fight infections, but in lymphoma, they grow uncontrollably. Since lymph nodes are often the first place where these abnormal cells gather, sampling them gives doctors the clearest picture of the disease. The biopsy allows pathologists to examine the cells under a microscope, looking for specific features that distinguish lymphoma from other causes of swollen lymph nodes, like infections or other cancers. There are different ways to perform a biopsy. The most comprehensive method is an excisional biopsy, where the entire lymph node is removed. This method provides ample tissue for detailed analysis, including cell shape, size, and arrangement. It also allows for advanced testing, such as immunophenotyping, which uses special markers to classify the lymphoma subtype. Knowing the exact type of lymphoma helps doctors choose the best treatment and predict outcomes. Another method is a core needle biopsy, which uses a needle to remove a small tissue sample. While less invasive and often quicker, it might not always provide enough tissue for full analysis. In some cases, especially with certain lymphoma types like Hodgkin lymphoma or peripheral T-cell lymphoma, a core needle biopsy might lead to inconclusive results. When that happens, an excisional biopsy is usually recommended to get a clearer picture. Beyond confirming the presence of lymphoma, the biopsy helps determine how aggressive the disease is by grading it. It also helps stage the lymphoma, showing how far it has spread in the body. This information is vital for planning treatment. Biopsies can also be repeated later to see how well treatment is working or if the disease has come back, although this is less common. In summary, a lymph node biopsy is vital because it provides the actual tissue needed to confirm lymphoma, identify its subtype, and guide treatment decisions. It helps prevent misdiagnosis and ensures patients receive the most appropriate care. Medical guidelines recommend excisional biopsy when possible, with core needle biopsy as an alternative, but always with enough tissue to allow for comprehensive testing. Always remember, consulting a healthcare professional is essential for personalized diagnosis and treatment planning.